Hello, my name is Colton Black. I'm a junior health science major here at Mizzou. After graduation, I would like to go into grad school and study to become a physical therapist. I chose to do medical malpractice litigation and its effect on healthcare because it really interested me and I just wanted to learn more about the topic because I've heard so many people talk about it and I wasn't as up to date on all the stuff that goes along with it as I should be. So, medical malpractice, it occurs when a hospital, doctor, or other healthcare professional, through a negligent act or omission, causes an injury to a patient. The negligence might be the result of errors in diagnosis, of treatment, aftercare, or health management, and litigation means the act or process of bringing or contesting a legal action in court. So, medical malpractice litigation would be when these claims are taken to court. One study showed that from all closed claims in the U.S. between 2002 and 2005, the results showed that 55% resulted in litigation, 60% of those claims were against obstetricians and gynecologists, and those claims that had to reach a trial verdict, 79% resulted in favor of the physician. The average time it took for just a regular malpractice case was 19 months, and those that went to trial and had to reach a verdict took 39 months on average. 1,452 closed claims ranging from 5 malpractice insurance companies in 4 regions of the United States were a part of this study. The majority of patients that received injury due to malpractice do not, in fact, sue. 80% of claims involved significant or major disability. 26% of the claims resulted in death. The average time to close claims was 5 years, and in the United States, doctors cannot work during this time. 56% of claims received compensation, averaging about $485,000 per claim. Claim total cost between this time exceeded $449 million. Non-payment errors exceeded the number of paid errors, though, so most claims didn't result in proven malpractice. Members of the Bush administration placed blame on rising healthcare costs on the malpractice claims that served no purpose. So they're saying people are saying that they're receiving malpractice, but they're actually not, and that's what's driving the cost up. The plaintiff's attorneys countered that the contingency fees and prevalent errors make the pursuit of meritless lawsuits bad business and unnecessary. So I was researching this, and one thing that came up was the shared decision making. So would shared decision making and decision support interventions reduce malpractice cases? So we have poor communication and the lack of information are the most commonly recorded sources of patients' dissatisfaction in healthcare. Communication errors strongly correlate to medical malpractice litigation cases, but the studies show that shared decision making and decision support interventions would only be an effective alternative to informed consent procedures, but it would not reduce the number of cases. Professionals providing additional services to reduce malpractice claims. One profession are breast pathologists. There was a study that showed that they order additional stains, recommend additional surgical samplings. They want the patients to get second opinions and choosing the more severe diagnosis on borderline cases, which means they are going above and beyond for someone who may not actually need the treatment, but they're going to give it to them anyway just to keep them from receiving a malpractice claim. Breast pathologists experience an increased amount of nervousness due to the lack of malpractice and spend more time on assurance behaviors. Therefore, they're ultimately seeing less patients. Cardiologist is another profession that sees this. They experience the most significant pressure due to malpractice claims. Practice defense medicine more than any other profession. So they increase diagnostic testing, referrals, and they hospitalize low-risk patients to keep these malpractice claims from coming up. In 2010, defensive medicine costs in the United States estimated $45 billion, causing healthcare costs to increase. Effects on physicians for the medical malpractice litigation claims: they spend longer time working on resolutions, and they don't allow trainees to do as much hands-on training as they need to do because of the concern of malpractice. They do not want their trainees to have to be involved with all this, so they're stepping up and spending longer time training them, and the trainees are not getting all the attention and hands-on activity as they should, and so they lose practice time as well. And they have added stress, work, and reputational damage, and so they spend a great deal of time maintaining their image instead of focusing on other important aspects of their job, like seeing more patients. The Healthcare Quality Improvement Act of 1986 granted physicians unprecedented legal protections when reviewing substandard practices during peer review processes. And although the fear of medical malpractice litigation can put a huge amount of stress and pressure on physicians, they are not held accountable for the monetary value that could be rewarded to patients after their claims were rewarded compensation. Medical malpractice reform. The Bush and Obama administration both believe that putting in place a liability system will control and limit malpractice cases and will reduce healthcare costs in some aspects, but they will not reduce the cost as a whole. Therefore, malpractice litigation is a factor in the increased cost of healthcare, but as a whole, it is not acting as one of the major factors for the cost. Outside of the United States, medical malpractice litigation in China, of 1,086 claims between 1998 and 2011, 76% of those claims received payment. The claims that resulted in cash compensation received far less money than the claims in the United States, though. As you remember, the United States was upwards of $400,000, and in China the average was $23,000, $721. Most doctors are still allowed to work, though, in China during a litigation trial. Therefore, they don't have as much stress on them as the physicians in the United States. But most of the claims in China, they were not necessarily on the physician themselves, but most claims resulted because of technology errors due to just the technology they have there, and it's not as good as it is in the United States. So here are a couple steps to avoid malpractice claims as a physician. They want you to obtain everything deemed necessary about the patient, so get all of the history you can to make sure you're not going to get into trouble later on down the road. They want you to discuss every aspect of the potential treatment with the patient, so they just know everything that can happen to them and everything about a diagnosis. And they need to make sure patients fully understand the potential risk and benefits of treatments. And then you need to maintain complete, accurate records so you can look back onto them if a claim came up later on down the road. And they want you to communicate fully with the patient. So overall, a summary: medical malpractice litigation does have an effect on healthcare, but it's not as huge as some may seem or some may think. The majority of claims do get settled without litigation, which is really good because those take a lot longer. And to reduce risk of malpractice, healthcare providers spend millions of extra dollars. The impact on healthcare is not as huge of a factor as some may think, though. It's best to make sure you have outstanding communication with your patient. And lastly, the chances of malpractice litigation do have a large impact on physicians.